Now, bowel cancer is one of the most common forms of the disease in the UK and one of the most fatal. But despite the dangers, a study has found worrying variations in the way it's treated, with particular concerns about younger patients. It found that 1 in 5 young people took more than a year to be diagnosed with the disease. A fifth saw their GP at least 5 times before then being referred to a specialist. As with many cancers, early diagnosis is of course key, something that Satori Hama sadly couldn't benefit from. She was just 33 when she was unexpectedly diagnosed. Before she died, just 3 years later, she spoke on film about her battle with the disease.
Going through something like this makes you realise the things that are more important than those that aren't. And it really changes the way you think, it puts things in perspective. And I think that you're more grateful for life and the things you do have.
What a fantastic smile. I'm joined now by Satori's fiancé, Kannan Ganga, and Deborah Alsina from Bowel Cancer UK. So pleased you could both be here. And it's a sad story about Satori, but she didn't know this was coming. Why? Why didn't she know about bowel cancer?
I'm afraid to say that she didn't go and see her doctor. So I didn't know when she was diagnosed. I met her only a year after her diagnosis. But actually, her family tell me that she'd complained about abdomen pain and she never acted upon it. She just took a painkiller. So unfortunately, if we could turn the clock back and she could go to see a doctor, perhaps she would still be here. When
she did finally go to see doctors, what did they say?
Well, it was very dramatic. Essentially, she was taken into accident emergency and they needed to operate on her within 12 hours. If she didn't have that operation, she wouldn't have, had three more years, I'm afraid.
So, Kannan, how does it make you feel when you hear these statistics that people, young people, like your fiancé, having to go to the doctor up to 5 times before then going to see a specialist?
Well, it's very worrying, clearly, because if only we'd knew, because unfortunately we could have done something about it then. We can't do anything about it now, so it's very startling.
It's fair to say, Deborah, isn't it, that diagnosing bowel cancer is not an easy thing to do, because the symptoms, whether they're in younger people or older people, are difficult to sort of pinpoint.
They can be. So some people do have very clear symptoms, but actually about 50% of patients have quite vague symptoms. And of course, many GPs do an absolutely fantastic job in terms of referring people through quickly, and that often leads to a quicker and swifter diagnosis. But the reality is there is real variation, but they will, of course, only see 1 or 2 cases of bowel cancer in someone as young as Satori during the course of their whole career. So it's difficult for them to detect it. But our key message here is it may be low risk, but there is a risk, so please rule it out much quicker.
And if you are experiencing those symptoms, it could be something else, but it could be something else important too, so worth getting checked out. It could be irritable bowel syndrome, for example, or something along those lines.
Absolutely. It could be a range of symptoms, from kind of very benign conditions to, as you say, things like ulcerative colitis or Crohn's disease, and all of these conditions require treatment, so much better if you have concerns to go to your doctor and to get checked.
How did Satori feel when she sort of became at one with the inevitable? She wanted to help other people.
Absolutely. I was in the room when the doctors said we were now switching to end-of-life care. She was more concerned about how I would react, and her father, utterly brave and courageous. At the time, she went back to the ward and she did a dance for the ladies in the ward.
Well, we saw in that video she loved dancing. That's what she's talking about, the freedom to dance after the treatment that she'd had.
Very much so. Dance, music and food, she could be whatever she wanted to be. And reflecting back, I thought that was very strange for someone to receive that news and react in that way. But I realised what she was doing. She was being incredibly brave for the ladies in the ward. And what I'd say is, you meet the most amazing people on the cancer journey. Satori was one of them. Hopefully, by spreading the news that Deborah is sharing with us, we can avoid other similar situations.
Just finally, Deborah, it's vitally important that people aren't embarrassed about this, and people ask questions if they don't know necessarily where their bowel is, or whether things are a bit unusual in that area.
absolutely right. We have to eat to live. So our body needs to process that food, and that's what your bowel is. It's part of your digestive system. And really, it's very stark here. We need people to be aware of it. We need people to be talking about it and acting on any concerns. People are dying needlessly of a disease that can be treated. It's time that stopped.
Thank you both very much indeed for coming in.
Thank you.